I'm going to introduce our first speaker, who is Dr. Jerry Levine. Dr. Levine is 61. So can I say how old you are? I mean, I wasn't going to say it, but it's written over here. Okay, he's a young 61, and he grew up in the rural area of north of New York City and trained in Boston for many years. His wife is a healthcare and employment lawyer. Good for negotiations with the hospital. Okay. She also started an organization after your experience called Melanoma Awareness Campaign. You have 7 children. Okay. A bunch of grandchildren. You enjoy all sports. And currently you're doing a lot of swimming and playing tennis. And in the past, basketball and running. The knees, not so good anymore, right? Yeah. And you spend a lot of time in the sun doing those outside activities. Jerry is a director of the Division of Pediatric Gastroenterology at NYU Langone and medical director of the Fink Children's Ambulatory Care Center at NYU Langone. He's a professor of pediatrics at the NYU School of Medicine, so please let's welcome Jerry.
Thank you very much. What I actually neglected to tell Rachel is that not only am I a cancer survivor, but I am the parent of a cancer survivor. About 18 years ago, 18 and a half years ago, I actually diagnosed my own child with Hodgkin's disease. And she had stage 4, and my family and us went through a year of chemo and radiation, et cetera, et cetera. And my daughter is again, gone through a long-standing cancer survivorship. And so I think based on that experience, as well as being in the medical field, I think we have been, I thought we were relatively knowledgeable about ways of sort of making sure that we take good care of ourselves, et cetera. As Dr. Axelrod alluded to, I'm a little bit of a health nut, and so I've basically exercise all the time, although unfortunately some of that's in the sun. And as a gastroenterologist, I get my colonoscopies and I do my blood tests and cholesterols and all that kind of other stuff. So I thought, like everybody else, that I'm immune to developing cancer. And I was busy in work one day when I happened to be walking past my computer between patients, and I saw that the Perlmutter Center was advertising a skin cancer screening program for the entire medical center. And I said to myself, well, first of all, I'm a little too busy for this. And 2, that I've actually never really gone for cancer screening, skin screening. So I made a deal with myself. I said, I'll give myself one try on the computer. And basically, because the advertisement was to the entire medical center, and it said, if you're the first 50 people who call, you can get an appointment. Otherwise, you're first come, first serve. So I said, I don't have time to be first come, first serve. I'm much too important and much too busy. But if I'm one of the first 50, I'll do it. So I quickly logged on to the computer and found the phone number and dialed, only to get a busy signal. And I said, of course, I'm not the only person who's making this phone call. And so I said, it's not worth it, but I'll try one more time. I tried one more time and again got a busy signal. And for some odd reason, I tried a third time and I actually got a voicemail. And I said, all right, I'm sure this is never going to happen, but I'll left my voice name and I went back to work, only to get a phone call several hours later saying I actually won the lottery and I'm one of the first 50. And so I said, okay, if I'm one of the first 50, I guess I might as well go. So sure enough, I went over whenever day it was, a couple of days later for this appointment, and stood on this relatively short line because I was one of the first 50, and got screened. And as I got screened by one of the residents, the resident said to me, oh, you have something in your back. I'm sure it's nothing, but I want you to come back tomorrow for a biopsy. And I, to this day, haven't seen what was in my back. It's not there anymore other than a scar, but I actually couldn't see it. I never would have seen it. So I came back the next day, and some other resident said, I may have told my wife, I'm not even sure if I did. I thought, oh, I'm sure it's nothing, but let's just do a biopsy. And call me back in 2 weeks, and we'll get the results. And sure enough, 24 hours later, I got a call from the same resident saying I had melanoma, and I needed to see the surgeon, who basically was the person I sit every day, once a week in the operating room with, talking about various things. And so luckily for me, I knew how to cut through some of the red tape, but I went to see the surgeon who did operation. And in fact, there's some, again, and now that I'm becoming a little bit more of an expert in melanoma, now having gone from becoming an expert in Hodgkin's disease, there's some some size where you don't have to worry, and some size that you start to do have to worry. Mine was already above the size that you don't have to worry anymore. But luckily, it was caught and had not spread. And so now the extent of my experience is that I go see the dermatologist on a every 3-month basis. Of course, at the second visit, she found another cancer in the same area. This was a basal cell, so it wasn't that significant. And so we've now changed all our experience insofar as things being done outside are done with appropriate sunblock and appropriate gear, especially when I'm outside in the water or whatever it is. And as a consequence of that, my wife also, as Dr. Askarad mentioned, is starting some awareness campaign, which has run already some skin screening programs and is setting up to do some other ones locally on the island where we live. So again, I've approached cancer survivorship from two aspects. One as a patient, although my experience again was relatively purely luck. I think that just happened to be wandering past the computer, happened to be for some reason diligent for a very short period of time, and have won the quote unquote lottery to go. Obviously, made my post-cancer experience, certainly very easy. But again, also having lived for the last 20 years as a parent of a cancer survivor, knowing at the time when she had my daughter, when she had her disease, she was relatively aggressive and she required actually multiple rounds of chemo and radiation, and is at high risk for secondary issues. And so we worry about that sort of on a regular daily basis. So it's sort of a funny world how as becoming a parent and then becoming an actual patient, it spans various aspects of it. So that's sort of my story in at least for the moment in a nutshell. And hopefully we as a family, myself and my wife, have learned from that experience to try to go out and help other people to raise awareness again, in this particular case, about skin cancer screening and melanoma awareness. Thank you.
So wait, Jerry, I want to ask you a question. So when, so it's twofold. One is you got diagnosed, but before that you had a child and you deal with children. So did you change in any way how you spoke to parents when you delivered bad news about their kids? When your child got diagnosed, did it change you at all?
Well, I mean, I've always thought that I was somewhat empathetic. Again, obviously we deal with children. Most of what I tell them is not generally bad news, but in my field. But I've always thought that I was sympathetic. But certainly living as a parent through that has certainly changed my approach and my ability to, I think, relate to the families of people who are going through cancer. Obviously, over the years, I've taken care of, unfortunately, many children who have GI problems as a consequence of their either underlying diagnosis or treatment. And again, obviously, they're a special group of people, and we try to be exceptionally, considerate about them. So yes, I think so. Whether it's based on personal experience or just based on having worked in that situation for many years, I don't know, but certainly we tried.
You're a lucky guy.
Thank you.
Yeah, thank you. You know, it's like the lost dog, you know about the lost dog? Blind in one eye, missing right ear, broken tail, answers to the name of Lucky. So, I mean, we find wonderful things in every situation. And I think the important thing also is that when you get diagnosed with cancer, that you're not defined by your cancer. Nobody ever said, oh, that's a stage 1 melanoma. You know, that, yeah. I think that you can become very vulnerable like that, especially if, you know, a physician comes in, they start talking to you and you're in your gown. And I mean, I can say, you know, in my practice, I have women I've followed for, you know, close to 30 years, and yeah, they're in their gowns. But when you're having a, you know, a really serious cancer conversation, that's just not the place to have it.